welcome to my educative channel. Today I'm going to talk about periorbital rejuvenation. This is my specialty, and I want to let you know, if you are looking for a plastic surgeon to perform an upper blepharoplasty, first you must to go to the mirror and to do this, to push the eyebrow up. If you do this and you look better and you are satisfied with this, you do not need an upper blepharoplasty. What do you need? You need is a forehead lift, a reposition of the tail of the eyebrow, and I perform this with 3 minimal incision in the forehead and in the temple area, one here, another here, and the other side. 3 minimal incisions. I developed this technique nearly 20 years ago. From these 3 minimal incisions, I reposition all the eyebrow in this position. The aging process is more relative to the ptosis of the eyebrow than the flaccidity of the upper eyelid. Generally, the plastic surgeon don't set the patient you need to reposition of the eyebrow, because the conventional forehead is an incision that is coronal incision. This is not good for the plastic surgeon, also is not good for the patient. Let me explain what I'm doing, what are doing in other plastic surgeons, and I want to show you my achievement in the periorbital rejuvenation. This is a coronal lift, and there are different kinds of coronal lift. Just an incision like this, or another like this in this area, or other this, or in resection in the middle, or resection in the eyebrow. And all these kind of incision produce a resection of the skin, and you must do suture all this. This white incision represent the incision to perform a forehead lift, endo-forehead lift. That does mean that introduce a cannula, and with this reposition all the forehead and the eyebrow, but without removing skin. Then you have all this to remove skin and this long incision, and you have all this for a forehead lift without without resection skin. But also the endo-forehead lift, that is less invasive. You have 3-5 incision, almost from 4 to 6 centimeters each one. A lot of incision, and also sometimes it's very difficult to perform in a patient without hair, in a bald patient. And you can see here all this incision, and you compare here my 3 minimal incision, and I perform this technique in patient, bald patient. You really don't know where the incision is done. And this is the comparison between a coronal lift with resection of the skin and my personal technique. Here, what I said at the beginning, this patient go to the plastic surgeon because have a diminishing of the the view field, and also because have a headache, have a tired look, sad look. And if you remove the skin here in a conventional upper eyelid, you are going to remove this fold, but you are going to pull down the tail of the forehead that is down. But this is my technique. This is 2 months after the procedures. I reposition the forehead and use laser technology in this area, also without removing skin. You can look for my personal technique, blepharoplasty. You can see here how it is possible to reposition all the forehead and the eyebrow without removing skin, and you can produce a change of the look of the patient. And this is the patient in 2004. Here the patient have a tired look, sad look, and here the expression changed completely. I performed this technique since 1984. In conclusion, to get an ideal rejuvenation, we must improve very single aging sign. What does mean is, in the upper eyelid, I perform laser, in the periorbital laser, and I reposition the tail of the eyebrow. And here is a combination of the technique. From here to here, I do not remove skin, I do not leave a scar. Always have natural results because I do not remove skin. It is impossible. You can see the change of the look, how I tighten and improve also the skin with laser. And this patient is 2001. Patient was received a blepharoplasty and come to me to ask me to perform another blepharoplasty. But the tail of the eyebrow was pulling down for the aging process, but also for the upper blepharoplasty, because all the upper blepharoplasty that remove skin of the upper eyelid pull down the eyebrow, and this is with the reposition. And you can see this wonderful result just with my technique of 3 small incisions in the forehead, my personal technique of the upper and lower eyelid blepharoplasty, that you have many videos explicative how I treat all this area without removing skin. Okay, I come here to Portugal to give a lecture, and I near to the swimming pool to perform this video. Have a nice day.